region is shown in these figures. It's looking at the probability of living to 65 when aged 20 from 1989 on, and that improved for those with university education. It went down for those with elementary education, so the gap increased dramatically. Now, if it can get bigger, potentially it can get smaller. And it's actually to try and understand the causes of these differences in the gap that the Commission, in part, was set up, the Commission on Social Determinants of Health, and we produced a set of recommendations on how to deal with it. There is a conversion of health challenges globally. In every region of the world, except for the very poorest, non-communicable disease represent the major burden of disease. In the very poorest region, there's more or less equal balance between communicable and non-communicable disease. So we need to be looking for common solutions across the world because we have common problems. The Commission on Social Determinants of Health did not, by and large, deal very much with the environmental question. But we said in our final report that next steps were to try and bring the climate change environmental agenda together with the social determinants of health, health equity agenda. Globally, who's dying from climate change? Those, of course, in the global south. And as we heard in the keynote lecture a moment ago, these are CO2 emissions. On the left hand is the scale for China and India. They're growing rapidly. They're still way below the Japanese level. But if we're going to think and act globally, then exactly as Professor Van Parijs said, we can't ask the Chinese to be on their bicycles while we have our four-wheel drives. This is a major issue for all of us. I was talking on BBC Radio this morning about the growing burden of obesity. The mean weight gain of Americans in the 1990s was 10 pounds. Airline distance flown was 515 billion passenger miles. The weight transported 1 mile by 1 gallon of fuel is 7.3 tons. So the added weight of Americans because of their obesity was another 350 million gallons of fuel just to carry fat Americans around the country. So the cost of that extra fuel was $1.1 billion and 3.8 million tons of CO2 because Americans got fat. Now, you may think this is a bit trivial, but when you were giving us the example of the bicycles near here, I actually thought it was quite a good thing to go, as a cyclist, to go down the hill and up the other side because it deals with the obesity question more than simply cycling on the flat. Health challenges are compounded by climate change. The Commission on Social Determinants of Health held a workshop in New Orleans. The reason that one of our US commissioners wanted us to have this workshop was not simply to once again hit the US government round the head about their failure to respond appropriately to Hurricane Katrina. But David Satcher, our US commissioner, said that what Katrina did was expose the fault lines in American society. So these are the key characteristics of pre-Hurricane Katrina Louisiana compared to the US. Percent African American, 32% versus 12%. Percent of children living in poverty, higher in Louisiana. Percent of people living in poverty, percent of non-elderly who are uninsured for medical care, percent of non-elderly with Medicaid. So in other words, Louisiana, on most of the indicators, social and health indicators, before Katrina, ranked something like 49th out of 50 or 50th out of 50. It was one of the poorest states in the United States. And pre-Katrina, infant mortality 10 versus 7, AIDS case rate 21 versus 14 for the US, 48 versus 25. Diabetes mortality is so bad that they rank 51st out of 50. I don't quite know how they manage that, but American tells me it depends whether you count Washington, D.C. But so on all these issues, both communicable and non-communicable disease. A year after Hurricane Katrina, there were 1,464 lives lost, 900,000 people displaced. The household population had gone down by 57%, housing with major severe damage, 30% of jobs were lost, businesses destroyed, 22 million tons of debris. And as one indicator of what had happened to poverty, this is the percent of adults with no usual source of medical care other than the emergency room. In the US, it's 14%, which by itself is scandalous. That 14% of the American population should have no usual source of medical care other than the emergency room. But for different subgroups of the New Orleans population, New Orleans parish, 34%, the economically disadvantaged, 37%. Those who previously were uninsured, 54%, had no usual source of medical care. Visiting there was worse than many low-income countries. The fact that there were simply no medical facilities. There were clearly more liquor stores than there were healthcare facilities. Much easier to buy a bottle of bourbon than it was to get treated for a cold. This, of course, couldn't happen in Europe, could it? When we look at the heat wave, the excess of deaths observed daily in France, 14,000 excess deaths in France in the 2003 heat wave, 7,000 in Germany, 4,200 in Spain, and so on. And who died in the heat wave in France? The elderly, those with loss of autonomy, socially isolated, living directly below the roof of a building, and of course living in cities. Yes, of course, it's always the case that external events, be they environmental, be they conflict, be they financial, are going selectively to impact those lower down the hierarchy more than they will those higher up. One important environmental issue has been food price volatility. I'm sure you're familiar with these, what happened between February 2007 and January 2008 in the rise of food prices. They came down again, although they're still high at historic levels, but they can leave behind them a trail of damage. Food prices rise. Let's say you no longer can feed your children nutritious food. You can actually cause permanent damage. The number of undernourished people in the world has risen to 963 million, just under 1 billion in 2007. Think and act globally. I was talking on the BBC this morning about the rising tide of obesity.